My name is Nicole, and my daughter's name is Abri. She is 16 years old and a cancer survivor who developed chronic regional pain syndrome in her stomach post-chemo treatment. She had gotten to the point with her pain that eating became very difficult, drinking became very difficult, to where she had a feeding tube and a PICC line and went septic twice and was completely bedridden about 2 years ago. Had to enter a rehab facility after going septic the second time. Could no longer sit up on her own, couldn't talk, couldn't walk, had to relearn how to do all that again. And we were up in Michigan during all of this time seeking naturopathic treatment because unfortunately the medical system made everything significantly worse. So we got back to Arizona about 4 months ago, and we're trying to find places here that could help her. And we were driving to Costco and happened to notice Hope Clinic on the side and thought, well, we would go check it out and see what it had to offer. And we've been coming here now, I think about 4 weeks. Abri loves it. It's something for her that actually works. It's not scary like the medical world has been for her. We didn't know it was a Christian organization when we came in, or that they were Christian. We came in and she started noticing on like the third time that we were here, she started noticing that the doors had names like Faith, Hope, Love, Believe, Blessed, and all the willow trees around. She loves willow trees. And that's when we looked into it more and realized that people here were people of faith, and that Dan and Dr. Oki were super sweet to pray over her, and it made her feel much more comfortable. The treatment that she has, the balancing that she has, she describes it as her morphine bed. So she has chronic regional pain syndrome. So she's always in pain. Her pain is at a 10 almost all of the time. Narcotics, nothing like that works for her. So what this does, when she's getting treatment, she feels almost like she's going under anesthesia. So it completely relaxes her to a place that she can't get on her own, but without all the horrible side effects. So that's been a huge blessing. They've also been doing, she's an amputee from her cancer treatment. It was a bone cancer. So they've been doing lasers on her, what she calls her stumpy. And like Mary Kay said, making stumpy less grumpy. So that helps a lot. She's been doing some of the treatment on her back. She also has pretty significant scoliosis from everything. That has been helping quite a bit as well. No, narcotics. For her, she's got a gene mutation as well as some other stuff going on where narcotics actually make everything far worse. In the hospital system, the pain medication that they put her on caused her to seize. She developed Bell's palsy. She was in a coma for 5 days. She coded twice. And we call her the side effect queen. If a narcotic has a side effect, if a medication has a side effect, she's going to develop the side effect. She is that little 1%er there that develops all of the negative things that you don't want to have happen. So narcotics, there is no pain relief for her at all. In fact, her pain relief, her body has learned her pain relief is to just shut off. She passes out from the pain. That's how she gets herself out of pain. So to have something like this that is actually helping to get her out of pain in a completely different way than her having to shut off her system or take a medication with horrible side effects has been huge for her. Kiddos that go through, she went through 17 rounds of chemo on a 7-year-old little body. And for 5 years, she was great. But we always say chemo is like the gift that keeps on giving. It comes back and affects these kids somewhere. We've had kids that have had lung failure. We've had kids that have had heart transplants. We've had kids that have had renal failure. For her, it just has always affected her in her stomach. And so it just significantly got worse and worse and worse. And then when she lost a bunch of weight due to not being so malnourished from trying to eat and nothing really working for her in her system. They did biopsies because she's had cancer, and that kind of sent off a nervous system storm, which developed into the chronic regional pain syndrome that she's dealing with today. Abri has been coming here to Hope 3 times a week. We kind of now let her lead what she's comfortable with and what she wants to do, and this is a place that she wanted to come to, so she asked to come. And so we set up going 3 days a week, and I think she would live with the treatment on her, the plates that she uses on her back 24/7 if she could. So yeah, it makes her very restful and relaxed and calm, and just to see her at peace for a while is, when she's in the treatment, she's almost asleep. It's funny, when Mary Kay lifts her up, she's like half awake, half asleep, but yeah, it's restful for her. And to just have that period of time where it's restful is great. And it gives us hope that, as Dr. Oki has said, over time, her body will get more used to being in that restful state. That's what we're hoping for. So we have actually spoken to lots of people since we've been coming here and just talking about what an amazing place this is. One, it's faith-based, which for us is huge because it makes us feel much more comfortable. And two, it's a treatment that you can get that is not going to have side effects. There's no downside. You're not going to have any ill effects after you leave here. So I would encourage anybody to try it. I mean, give it a shot, see if it works. It's not going to hurt you in any way. And hopefully it's the pain management that someone would need, like Abri.